I'm actually currently the CMAO for real world evidence, patient advocacy, and external collaborations at Pfizer. But I had a 30-year career in academic medicine and transitioned to global blood therapeutics several years ago to head up research development and medical affairs for that company as they work to improve the lives of those living with sickle cell. And then I have stayed on with our Pfizer colleagues as we were acquired by Pfizer about a year ago. Peter, I'm coming from this, full disclosure, from the perspective of somebody who has had a 30+ year in academic medicine focused on clinical research and clinical care for those children living with sickle cell disease. And I will say that this has just been an incredible ASH experience. The science is just compelling. I'm very excited about some of the advances that have happened in the sickle cell space, particularly as you're alluding to the recent FDA approval for these gene therapies. I think provides more options for individuals living with sickle cell disease. And that is really, really compelling and promising. I think that one of the things that is really exciting is to give them options and to do it in the context of shared decision making. And really doing that means that if we have more therapies that alleviate symptoms, the better this community will be. And this community has been marginalized for so long. They deserve this incredible interest and advancement in the clinical care. The ASH experience has been really inspiring because we see so many therapies that are moving out of early development into late development in the sickle cell space. One of the things that I've really enjoyed is to hear more information on Pfizer's GBT601. I've been very interested in Oxbryta, which is our FDA-approved drug for sickle hemoglobin polymerization inhibition. That was FDA approved in late November of 2019. And we are really pleased that the data that we shared at ASH indicates that we may have a next generation sickle hemoglobin polymerization inhibitor that will have higher efficacy at lower doses. And so that, I think, is one of the things that has really excited me about ASH this year. 601 is our next generation sickle hemoglobin polymerization inhibitor, which should reduce sickling in individuals with sickle cell disease. It's built on the shoulders of Oxbryta, that showed a first-in-class oral drug could increase baseline hemoglobins in individuals with sickle cell disease greater than 1 gram per deciliter. And we shared information with our phase 2 study in individuals that either received 100 milligrams or 150 milligrams of GBT601 daily, and showed a 2.7 and a 3.2 increase in steady state hemoglobin, respectively. That information is in the context of really showing also that 601 is relatively well tolerated with very different side effect profile than we saw with Oxbryta, really having treatment-related events that were related to nausea and some vomiting, but not as much loose stool and things as we saw in early days with Oxbryta. Now we have to, really wait for this information to mature. We haven't really done the long-term phase 3 study that we'll need to be able to say how this advances alongside Oxbryta. But this data was very, very reassuring to see early on. Yeah, 601 will go from its phase 2/3 into its randomized controlled trial. And we'll look at 601 for outcomes in changes in hemoglobin and endpoints such as pain in a treatment versus a placebo group. And we're hoping to get that underway as we're rounding up the end of the early phase 2 study. We have another biologic. We have actually inclacumab, which is a p-selectin inhibitor that is also in phase 3 trials right now. And we're hoping that we'll have more information on inclacumab within the next 2 years, as we have really looked at whether or not that agent can be effective in reducing acute pain episodes in individuals with sickle cell disease. One of the things that I think is really important for individuals who provide care for children and adults with sickle cell disease is to really stay attuned and informed about the FDA-approved drugs and then what's in clinical trials. And I think it is very important to have a discussion with children and their caregivers or adult patients about the therapeutic landscape. Talk about the underlying pathophysiology of sickle cell disease. Talk about the complications of sickle cell disease so they understand what the natural history would be if we didn't have these therapies. And then talk to them about what value these therapies add. And then finally, make sure that this is the right therapy for that individual. If you have individuals who may be living relatively pain-free with sickle cell disease, you might select one agent. If you have somebody who has very, very brisk hemolysis or steady state anemia, that is something that is another discussion about how to address that long-term. But I think the providers need to be very transparent with individuals with sickle cell disease about the complication landscape. We discuss acute pain episodes and the need to prevent acute pain in sickle cell, because that's kind of one of the things that we think about as a characterization of sickle cell disease is the acute pain. But many individuals with sickle cell disease are dying from complications related to end organ failure. And they're experiencing anemia and the complications associated with anemia. So really broadening the conversation to include acute pain and address that, but also the impact of their condition on their organs and survival. And having that conversation, I think, needs to be done multiple times as individuals come to clinic to see their providers, so that they are truly aware of what the options are for them, and then they can select the best therapies for them with their healthcare team. Sickle cell has come a long way, and I think it's really reassuring to me that we're moving in the right direction to see all of these new therapies come down the pike. I'm particularly excited about the ones that Pfizer has in its therapeutic regimen, but I think that it's also really important that the visibility around this is increased, and without you, we couldn't do that. So thank you for being interested.